All right, thanks everybody for joining us today. We're going to give folks another minute or two to join the call before getting started, so we'll just hang tight here for another minute or so. All right, so I guess we can go ahead and get started as folks are continuing to join in. We ask that everybody stay on mute throughout the presentation, and if you have questions, please submit them in the chat box below. But just to kick things off here, today we're going to be talking about navigating complex benefit strategies, specifically cost-saving strategies that employers and benefit brokers are putting together in the reference-based pricing world. So we're excited today to have a great group of speakers. I'm Rob Lehane. I'm the CEO of TouchCare. TouchCare is a healthcare concierge healthcare advocacy firm. We work with employers, large and small, of all different shapes and sizes and funding strategies to help their employees and their family members have a better experience when navigating the complexities of the plan, the healthcare system, et cetera, helping with everything from open enrollment to complex billing issues to, helping find high quality, low cost care and sort of everything in between. I'm joined today by Cody Gill, who runs client services for us. She oversees and really has ownership of our service team that specifically handles the member experience. So Cody's been with TouchCare for 4 years now and has sort of done and seen it all as it relates to all sorts of different funding strategies, employer group sizes, et cetera. We're also joined today by Ashley Ross, who is the SVP of Sales at Maestro Health. Recently, earlier this year, TouchCare and Maestro launched a partnership together, specifically targeting delivering a better member experience for Maestro's clients that are RBP or not. So very much looking forward to hearing from Ashley here first as we kick off the webinar and sort of dive into the ways that TouchCare and Maestro work together to create a better member experience in reference-based pricing and beyond. So with that, I will kick it over to you, Ashley.
Of course, I should unmute myself before I start talking. So thank you, Rob. I appreciate everyone having me. And so we'll go over, most of you should be fairly familiar with reference-based pricing, but we'll go over a little bit of why our clients choose a reference-based pricing over a standard plan. And that runs the full gamut of fully insured all the way through, are you self-funding through a carrier or to a TPA, and then on to reference-based pricing. So like Rob said, please feel free to put questions in the chat box and we will answer them towards the end, but don't lose the train of thought. So why do our clients might choose reference-based pricing plan versus traditional strategies? In traditional strategies, you pick from a cookie cutter box. So with your fully insured plan, you don't really have any customization. You get asked, you want plan 1, 2, or 3. These are the benefits that will cover under each plan. And you have no insight into if you change a copay or if you change a deductible, where your costs are going and why they're rising. So that means no control over your rates, your network access, or pricing. Your doctor has to be participating in that network for in-network rates. If they're out of network, you can choose not to have out-of-network coverage, or it has a higher out-of-pocket for your membership. And again, that leads to lack of transparency with those negotiated rates. No one really knows what those negotiated rates are. You'll have some of the bigger carriers, United's, Blue Cross, say, we have 52% discount. Well, discount of what? What was that rate that was billed? We don't know, and they won't tell us until after that discount comes through. By transitioning to a reference-based pricing health plan, the clients gain more control over their spend and where they can direct their members to go. Next slide. An RBP plan is more options. So we're not tied to any rates, fees, or restrictions. An example I use pretty often in this is gastric bypass surgery. We can choose to set up your plan to pay at a certain payment level at certain facilities for gastric bypass, obviously meeting certain requirements. That is helping to define your plan language. We design the plan around all utilization. So we can look at what is actually going on to your group and how you want to control those costs. You could have a high diabetic population, high cholesterol. You could have a lot of orthopedic surgeries. If we can look at your past spend, we can predict where some of those spends are going to be and help customize your plan around that utilization and give you access to quality care and have healthy outcomes with vendors that you want to work with. And that's one of the things that we love so much about TouchCare. They help guide through those quality care providers and make sure that the membership is taken care of. This will also address your cost drivers with incentives and educational resources. At Maestro and TouchCare, we help build out incentives to drive membership to those higher quality, lower cost providers. And we provide your educational resources to do so. We have a very robust marketing team that we've worked closely with TouchCare in order to create membership materials that help them understand their new solution. Next slide. Between 2009 and 2019, employer contribution costs increased by 48%. As you can see by this graph, it's affecting the small to middle market groups most often, and they're having to look at other options. Your number 2 line item for any employer is actually benefits. Number 1 is payroll. So if this is increasing by 48%, your overall spend in just a little of 10 years has gone up drastically. Okay. What to expect with reference-based pricing? So many of our consultants and our clients say, oh my goodness, reference-based pricing, I don't know what that means. They can just go to any facility, they can pick any provider. We don't know how to tell them, how to guide them. And then what happens when there's a claim? When they show their ID card, what do we do? So balance bill is typically managed with Maestro and TouchCare partnership. The member will get care initially. So they'll go just like they do on any other ID card. They'll show their ID card at the physician. The member has a $2,000 deductible, let's say, then 80/20 coinsurance. Member gets care. They don't pay anything up front unless they had a copay or their fair share of what that bill will be. The provider sends the bill to Maestro Health. Then TouchCare takes that bill, reviews and audits the bill for accuracy. I don't know about most of you, but I make mistakes in my email every day, and I'm so grateful for autocorrect and spell check. I would be lost without it. We all have those 1 or 2 words that we can't spell, even though we should, that I make mistakes on all of the time. So to think that there's not going to be errors on a bill that comes from a provider is kind of foolish in my mind. So TouchCare will review and audit that bill to make sure it's accurate. Once they have determined that it's accurate, TouchCare works with the repricers to negotiate the bill with the providers. So TouchCare will go back with our reference-based pricing vendors and work with Dr. Smith, for example, and say, hey, you billed 700 times Medicare. That's not really a fair and reasonable amount. And we'll work with them to make sure those bills get lowered and we're all paying a fair and reasonable price. Maestro Health then will submit a fair and reasonable payment that has already been negotiated back to the provider, and TouchCare will provide support for appeals and disputes. Should less than 3% of the time do we get a balanced bill with our reference-based pricing vendors, and once we send a dispute, we then less than 1% all have a second appeal. So we don't see a lot of pushback, but part of that is because we've taken a more proactive approach. As we look at that portion where it says TouchCare works with the repricers, they work closely with them in order to make sure that we are giving those fair and reasonable prices so that we don't create an additional headache for the member. And TouchCare really takes that off their plate. Next. So how does self-funded measure up? We all know how fully insured works. you have a premium, you're going to pay that premium the same price every month. It might vary depending on your population. Do you have people that leave, or you have new hires? So in this case, we're saying that the claims expense is $690,000 and the insurer retention is $280,000. So the premiums are $970,000. So that means the insurer is making $280,000. There's no chance of a fully insured case getting this fee back. And also, typically, we don't see decreases just because you had a good claims year. We're still going to see an increase on your premium next year. Now, it could be lower. I haven't seen anything under 10% yet this year. Most of it's going up, but some of that can be negotiable. And I've even seen renewals closer in the 40 to 50% increase. Now, if you go to self-funding, and this is just a step, this isn't even necessarily reference-based pricing, the employer plan, the total paid is going to be $850,000. So the employer plan savings is $120,000. We're still having the same expected claims of $690,000. Stop loss, you're paying $130,000, and then just a mere $30,000 in administration. So your fixed expenses are at $160,000. Those expected claims can vary. If we have less than expected, great. That includes more savings towards the employer or plan. And again, in this situation, you can see that the total paid on this is still less than the fully insured premiums. And that's typically what we expect in most of our groups. Next. Transparency is the most important item for both us as a TPA and in any self-funded situation. We operate on a fully transparent model, so the employers and our consultants know exactly what we're paying for. When we break down our prices, we put them into PEPM rates. We give you the fair and reasonable numbers that are what are going to be cost every month for the year, obviously barring any mass layoffs or adding new hires or acquisitions. We don't want you to be surprised with any upcoming changes or confusing bundles. We really want to make sure you know exactly what you're paying for. And so that's why we will line item every single item that your service that you're receiving from Maestro and TouchCare. We do mindful claims auditing. We at Maestro only auto trigger 10% of all of our claims. And then especially on our reference-based pricing, we work closely with our repricers and our claims department to make sure that every claim is looked at that needs to be looked at. And we personally review all high dollar and complex claims, and that goes through a hierarchy of our staff to make sure that those are being paid properly and there aren't any other confusing issues. We also have what we call Maestro Health Analytics, and we personalize group stats and plan insights to help identify savings opportunities. So we white label a product, and we have a full analytics suite that we can offer insight into what is going on in your particular group to see who is driving the costs. Are there frequent flyers at the ER? Can we redirect them to urgent cares or maybe get them primary care physicians? Do we need to set up incentives for high cholesterol, high blood pressure, COPD? Things of that nature. So we can really take a look into your analytics of your particular group and make sure we're building the right plan for you and make changes in order to help the savings for the employer and maybe for the member. And then our member engagement solutions through TouchCare. TouchCare's phone number is on all of our ID cards. They are a first stop for our membership. So they're people-focused engagement and educational tools to keep members informed and interested. We all know, and I use my husband as a great example of this. My husband I'm on his insurance, and in one ear, out the other ear, he has no idea what changes from year to year. So I review all of our benefits and make sure that we are selecting the best plan for us. Now, I have the I'm lucky enough, obviously, to be in the industry, so I kind of understand what's going on. But even some of their materials, I'm like, what is the point of this? Why are you sharing this? It doesn't make sense. So TouchCare has done a really phenomenal job of putting those tools together and keeping members up to date quarterly, biannually, whatever works for us. We want to make sure that we are getting in front of your membership to keep them up to date. Next slide. So more plan insights and data. This gives you an example of what we are offering as far as our reports. So we do have our standard monthly and quarterly reports that will help us make recommendations not only throughout the year, but also upon renewals. We give you executive summaries, KPIs, and recommendations, the plan cost, and specific claims analysis by member, which is really, really important. So again, if we know that Ashley, for example, is a frequent flyer at the ER, we want to break that down and see why it's a frequent flyer and what we can do to change behavior. We also do offer our analytics, which gives your whole health plan a snapshot. We do risk scoring, and then where there might be gaps in care. And our account managers work very closely with the contact at the group as well as our consultants to go over these reports, and we can set them up to be produced for the group every month. We can set up time for our account managers to talk to the group every month or every quarter. Really, we follow our consultants' lead to make sure that we are timely in our discussions. We also then do, not yet, sorry. We also do our plan performance review report. So medical trends like top providers, chronic condition prevalence. I know I've mentioned these multiple times, but I think it's really important to understand these reports and what's going on in your groups, and also our clinical management reporting. We do have a very robust suite of what we call critical care management. And so that stems from all the way from wellness all the way up through acute case management. So understanding what's going on and where our nurse activity is showing most prevalent and making sure they're providing the best services to your membership. Okay. So we will talk a little bit about PPO, or a reference-based pricing dual option plan. We'd like to give you choices. We know not everyone wants to deep dive into reference-based pricing, but this is a great first step, is taking a dual option and offering a traditional PPO plan accessing the Cigna network, and then also offering a facility-only RBP plan with a separate non-Cigna physician-only network. And the reason we do this on the RBP plan is offering a physician-only network gives sort of an umbrella, a cushion. Because if you tell your average employee, you can go to whatever doctor, wherever you want, it can be a look of confusion because it's not the norm today. It's very different than, okay, you have to go find a doctor in your network and where do you want to access it? So we give them that cushion. And honestly, most of the cost savings of reference-based pricing is not based on a physician. Your average physician makes good money, but that's not where we see a very big problem with overbilling. So we want to guide those membership to have the easiest process. Now, TouchCare does work with our clients that have both a PPO and a reference-based pricing product. And so we can code them in our system so they know if Sally has the traditional PPO and Bobby has the RBP plan. So we handle all of those nitty-gritty details to make sure that they, again, experience the best possible solution. We'll manage all of your eligibility, claims administration, and member services, and that works closely with TouchCare. And then we'll identify and coordinate all of the stop loss options. So we will send check registers, and all of that comes through us on both plans, so that way we can make sure that they are streamlined through those providers. So why self-fund with Maestro Health and TouchCare? As you can see, the bullet points get significantly more when we get into self-funding with Maestro Health. On fully insured, you might have an access to a strong national provider network, predictable experience, and taxed on your entire premium. And then we do see the stepping stones where groups go from fully insured. Okay, I want a little more control. Let's jump into level funding. So I still feel like I'm paying just the same monthly fee. I don't feel like I'm getting hit really hard. It's great. You might have access to some of your data. Usually there's a fee tied to it. And you pay a claims premium upfront each month. And then you can technically recoup any unused dollars, but we don't see it very often. Most often your fixed costs are higher on level funding, and there's little to no return. Then self-funding with a carrier. You have access to your data, again, with a fee, or as we joke very often, if you call on the third Tuesday of the month at 1 o'clock, then maybe you can get your data. Otherwise, you just hope for the best. You still then only pay for the claims you incur, which is great, but it's a little harder to really fully understand. And you typically have to bundle everything together, so you don't have the same freedom of unbundling and choosing the vendors that you want to work with. Now, self-funding with an independent TPA, very similar. We are an independent TPA at Maestro Health, but they give you access to a national network if we want to use a PPO or reference-based pricing. a lot of other TPAs for the level of analytics that we'll give you through both Maestro and TouchCare. There's an additional fee for it. Bonus, obviously, we only pay for the claims that you incur. Highly flexible plan design and structure, and plug and play. For us at Maestro, we have our own in-house clinical care management team, which is extremely important because that does give us access to provide reporting and pair it together with what your analytics look like and how we're going to affect that change. And it gives us more guidance. The in-house clinical care management team also ties into our stop loss team. So that means that the notes that our clinical nurses are taking provide into stop loss to give better detail and better information to make sure that your stop loss is also fair and reasonably rated. TouchCare provides all of our advocacy and navigation for both RBP and PPO plans, and they really do a phenomenal job in conjunction with our teams. Next. So this is another slide to show through what we offer as advantages of self-funding with Maestro Health, a little higher level. So the high touch customer service, in my opinion, is really because of TouchCare. We have customer service at Maestro as well, but TouchCare really provides that next level where the member feels like they have a person in their corner. No one wants to be going through difficult times when they're already having one of the biggest scares of their life with health conditions. If we have members that get diagnosed with cancer, they sure as heck don't want to be thinking about, is my insurance going to pay this? Where do I go? What do I do? Am I going to have to file for bankruptcy? We all know people that that's happened to. So TouchCare works closely with both Maestro, our stop loss carriers, our membership to make sure they're going through the right process. And we can customize that member engagement, again, with marketing pieces and tools that we can hand out to the membership. There's a dedicated team to help interpret the plain data and service recommendations and insights. So not only do we have that on Maestro, but we work with that with TouchCare to provide them the information that might help a member in making decisions. And then also we do innovative network solutions, narrow networks, direct contracting. Again, TouchCare gets all of that information to make sure they're guiding membership to the right places. So last, I will do a brief overview on a case study. We all know that COVID-19 has been at the top of our focus the past year and a half. Well, we all didn't know how the claims were going to come in when this first happened. We were worried about, are we going to have a high influx of screenings? Are we going to have influx of hospital stays? So in one of the most recent case studies we did, we have a very rapid response strategy. So as soon as those claims come in, we want to avoid readmissions and complications. We did have a member that was admitted with COVID-19 diagnosis and was able to work closely with our nurse team that is at Maestro and manager after their discharge to create a post-admission care plan. COVID-19 can be scary, especially if you're in a certain demographic and you have comorbidities. We want to make sure that we don't get a readmission, which in this case, an intervention by our nurse resulted in a $15,000 avoided healthcare cost for the employer and an avoided hospital stay for the member. Nobody wants to go to the hospital. Everyone wants to stay at home if they can. So we help that member accomplish that. Our utilization management nurse then helped obtain a prior authorization for oxygen at home. So then that nurse took the step to say, let's get this at home. Because you're experiencing shortness of breath, we don't want you to have to go and re-risk being exposed to COVID-19 and get another diagnosis, potentially have another stay. And that intervention resulted in over $13,000 in avoided healthcare costs. And again, another possible hospital stay for the member. Then in this scenario, this is reference-based pricing, we caught bad billing practices. So our claims team identified an out-of-network lab that was conducting excessive testing and aggressive billing. A lab was billing for a COVID test for an ER visit, when it was not an ER visit, it was simply a COVID lab, and that's it. So it was resulting in charges of roughly $1,100 for 3 tests per member. The clinical team worked with the client and we redirected the entire group to in-network labs. And so that's what TouchCare will do. They'll work with Maestro, and then we can drive that membership to in-network labs to avoid these additional charges. Sure, $1,100 doesn't sound like a ton of money for one member, but when we start looking at a 400, 500, 600 life group that's getting COVID tests and going to this out-of-network lab, and then provide them education, it saves quite a bit of money. Okay, so that is the end for me. Obviously, if you have any questions, please put them in the chat and we will get to them. But I'm going to pass this over to Cody to go into some of the TouchCare advances.
Great, thank you so much, Ashley. This was really helpful information for, I'm sure, all of our clients and our partners, and we really appreciate the insight and the value that you guys bring to our partnership for sure. So just to remind everyone, my name is Cody Gill. I'm the Vice President of Client Success here at TouchCare. I like to say that we have seen it all, but there's always a wonderful surprise, and I'm sure we haven't seen it all, but we definitely have a lot of experience in this model. And today I'm going to discuss how TouchCare helps streamline the member experience within the RBP model, some of the challenges that members might face, and how we can help solve those challenges through our solution. I'm also going to speak through a couple of real examples of how we have assisted a few of our reference-based members. Something that most who are in benefits can sometimes take for granted is the knowledge of the general population regarding healthcare, health plans, and how to manage their own administrative or coordination aspects regarding to the needs of a member or their dependents. So in general, most of the population struggles with basic plan knowledge. Adding a model that is reliant on education and consumerism might create an additional layer of challenges for the employee population if the appropriate support resources are not provided. So that's where TouchCare can come in and really save the day. Our first step with any reference-based client is identifying and creating the custom workflows that align with the resources within the plan. Like we've done with Maestro, we design custom workflows that align with different needs or questions that members might have. So workflows are designed to empower our team of health assistants and billing specialists to resolve member needs, leveraging all of the tools that are available, information, and the relationships that have been developed on behalf of the client. Oftentimes, also like with Maestro, our team obtains access to systems that allow us to easily capture claims information, accumulators, and anything else that's needed on behalf of the employees. Creating custom workflows with TPAs and the repricers helps us align information quickly to resolve any issues that members might have as efficiently and effectively as possible. So after designing our workflows, we then structure and train a dedicated pod within our service team. We like to say we are not a call center. We do have dedicated pods that work directly on behalf of our clients. So these individuals on our team are specialized in specific areas, and they work together to create the best outcomes for some of the most challenging member cases that we have. Members will work with the same specialist from start to finish, regardless of whatever the need they have and regardless of how long it takes us to work with all of the entities to resolve that need. The support pods are united and they work together to provide creative outcomes while maintaining a singular point of contact for the member. We also believe in member education. Always, always, always. We are always educating prior to even employees selecting a plan. So our team offers one-to-one open enrollment consultations to walk through the plan options and to explain resources that align with anything the members might experience. We also explain that TouchCare is here to serve as their personal assistants and that members can always call us if they are confused or if they need our help with anything related to their plan or their benefits in general. I'd also like to mention open enrollment assistance is available year-round. So not just during open enrollment, but also when the group has new hires or when an employee experiences a qualifying life event. One of the main challenges that members might face within this model is understanding if they have been balance billed and determining what their patient responsibility actually is. So most employees do not understand the information on an explanation of benefits or how to align an EOB with a bill that they might have received from a provider. One of the ways that we assist our members is by having the member send us their bills for an assessment. We educate the member by aligning the EOB against the bill to help them determine their patient responsibility and then to determine if they have been balance billed. We then prompt the member to resolve their patient responsibility, and if they have in fact been balance billed, we submit their bill to the structured repricer to begin the resolution process. Throughout the entire process, we remain the single point of contact with the member to provide updates, information, and additional assistance. Another key area that might be frustrating for members is finding and choosing providers. Within the resources that are provided, our team will assess the options available for our members based upon their personal health needs, and we will contact the providers, explain the claim submission process, and schedule appointments after the members assess the options that we provide to them. So as you can most likely see, TouchCare acts as the first line of contact for any need a member might have, regardless of their model their employer has selected. We work on the member's behalf to educate, de-escalate, and resolve any questions or challenges they might face. Additionally, each client is assigned a dedicated account management resource for additional engagement and educational support. So now I'm going to walk through a couple of examples of how we have assisted just a couple of our members. And as you can imagine, within any model, there are always confused individuals who need additional help. But in the reference-based model, people might need a little bit of additional hand-holding. So this is one example of an individual who looked at their bills and clearly did not know how to handle those situations. We received over 73 bills from one individual, and our billing specialist had to combine all the bills, identify all the duplicates, determine what the patient responsibility was, what the balance bills were, and actually work with multiple entities, including the providers, of course the patient or the member, and then of course the repricer, to really just navigate the entire experience on behalf of the member. This member was so frustrated and overwhelmed, they just literally kept putting their bills in their nightstand drawer. So when a family member actually went to the nightstand and saw all of the bills, they reached out to the employer group, and HR called us to swoop in and assist. So this is just one area of how our specialists can really help a member who might be overwhelmed and who might be really confused about the situation. So this next situation is something that sometimes occurs, not often, but sometimes. An individual was going in for surgery, had really not done all of the work proactively to make sure that the provider had all of the information necessary. There was no pre-authorization in place. Really nothing had been done proactively. So they were being told that they had to pay an out-of-pocket cost of $36,000 before they could actually have their procedure. So our TouchCare specialists were able to leverage all of the resources to kick off a single case agreement, coordination with the facility, the provider, and make sure that everything was all set so that individual could go ahead and pursue the care that they needed. So as you can see, there are a variety of different ways that we can work with our members to really assist them through any type of circumstance and any type of plan. But with reference-based, that might be a little bit different for them. We do hold their hands and we do act as their advocates throughout their process. All right, so I'd like to reintroduce Rob Lehane from our team. He is our fearless leader, and he's going to walk through a little bit of additional information.
Sure, thanks, Cody. I think, getting to these last couple slides here, I think, how TouchCare supports RBP clients, you've really kind of driven that point home, and the case studies are really the most impactful. I think it's important to note too, I mentioned at the outset, but TouchCare works with employer groups of all different shapes, sizes, funding mechanisms, networks, et cetera. And so, we didn't intentionally per se get into the reference-based pricing game as much as we did, meet clients and employers who needed problems solved and then worked with them to customize, to Cody's points earlier, workflows and solutions that made sense. And sort of through doing that with more and more customers and TPAs and developing a relationship with Maestro, we've kind of gotten more and more into reference-based pricing and knowledgeable of it, of course. And and have developed some really great services and that are delivering great member experiences. But I think it's important to note that no two clients for us look exactly the same, and so it takes a partnership all around to make that member experience as great as possible, and especially with regards to reference-based pricing when you're potentially putting employees and their family members in a position that they're either not used to being in or not necessarily comfortable with when it comes to the financials of their medical plan or even navigating the medical plan. It's important for us just to act as a partner with the HR team, with the TPA, with the repricer, and all the different parties involved to make sure that we can deliver a great member experience and communicate with folks throughout and make them feel good about the decisions that they've made and that the employer has made on their behalf to give them a great plan, just with a different funding mechanism that they're used to. Which kind of brings us to our next slide, and really, I always centralized member experience. I always refer to us at TouchCare as sort of the traffic cops, right? We work directly with members to really centralize that member experience and try to get them to the right solution at the right time that makes the most sense for their unique situation. No matter what the plan looks like, we want to make sure that member has the best experience possible, has the most cost-effective and best outcome possible, and leverages all the different tools and resources that are available to them as a part of the greater employee benefits package, right? So the medical plan, disability, life. Hopefully we're not using life, but the voluntary benefits, EAP programs, telemedicine, second opinion programs, et cetera. All of that are ways that we try to bring more value to that member experience and drive more engagement into all of the programs that you as an employer have invested in to improve that member experience, reduce their costs, and drive better outcomes. So with that, I will go ahead and I guess formally wrap up the presentation part of this, and we can jump into the Q&A. We've got a few questions that came across there at the bottom already, so I can jump right into a handful of those first, and then as more and more come in, we're happy to get to them, and if not, we can send this presentation out afterwards to everybody who attended. So the first question here is, and I guess I just kind of answered this a little bit, but does TouchCare support other benefits beyond the medical plan? The answer is yes, we support the entire employee benefits package. So we help folks with filing disability claims, sort of the cross-contamination that can occur between a disability claim and a medical claim, et cetera. Voluntary benefits we support. We support, really anything that touches that employee benefits package. What would you say is the biggest challenge for clients when they switch to an RBP plan? I will kick this one back to Morning Cody. Yeah, you guys want to jump in?
Yeah, so I'd say the biggest challenge is the member engagement and adoption, which is part of why we look so closely at what materials we want to share with the membership and make them really understand. There needs to be ample time for training. If we're in June now and you have an August 1st date and you come to me with a group that's fully insured and wants to move to RBP, I will kindly tell you no, or we're going to push the effective date. You need to have at least 60 days to really review with the membership and make sure that they understand the changes and how it affects them and what those processes look like.
Yeah,
Awesome.
Ashley, just a couple with that. I couldn't agree more. I think education is the key here. We have, experienced clients who've, provided amazing education, and then clients, where we've come in a little bit after the fact and we're reigniting education for the population. So that can be really frustrating. I'd say education is really the key component that needs to be highlighted with any change, especially to reference-based pricing.
Awesome. So the next question here, Ashley and Cody, I know we've worked on a couple of groups together that sort of meet this bill, but does TouchCare support dual option plans?
Yes.
Yeah, go ahead.
We have organizations that have a traditional model and an RBP dual option model and combined. So we can, the great thing about TouchCare is we're streamlining the entire member experience, regardless of the plans that you offer and regardless of the entire benefits package that you offer. So you can define what that means, and we really are just here to assist everyone and to become real experts with whatever it is that you have spent the time creating for your population.
And I'll echo that. It's a lot of what we hear from groups or members that have come from a traditional fully insured or even self-funded with a carrier is they sit on hold for a long time. They don't get to talk to the same individual. They have to retell their story because no one took good notes. And that's something that we avoid by utilizing TouchCare. You work within the pods. They know what's going on with the membership and their claim, and they know how to work through everything. So you get much more of even though TouchCare is not a small company, you get much more of a hand-holding feel, which I think is important, especially in the customer service industry that we are in.
Awesome. And then I guess the last question that is up here right now is how do TouchCare and Maestro work with the repricer?
So Maestro Health has two different repricers that we utilize. We utilize 6 Degrees and AMPS today. We have not signed exclusives with either of them because the climate is always changing. But Maestro Health, we take lead in providing proposals, and we work very closely with our repricers that know our internal teams very well in setting up the plans. Some of our markets have direct contracts in place with those repricers that we can guide membership to already. Some of those other markets, they will set up direct contracts if that's something of interest. Obviously, that takes a bit more time, but we build out the plan completely in conjunction with the repricer, and TouchCare is involved in that entire process.
Yeah, I think it's important to note that this is one big, well-oiled machine of everybody really working together. From our angle, we always have to keep any question that the member might possibly ask in mind when we're developing a workflow with either the TPA or the repricer. So we also work with AMPS and 6 Degrees, and we have on actually several cases, and we have very effective workflows that are easily able to be adjusted per client, and we've gotten to know one another so well within all of the teams that resolution is much simpler than not having that type of relationship or not having the experience that we've had with them in the past.
Awesome. Well, that I think wraps it up for the Q&A for now. And like I said, we'll be sending out a copy of the presentation to folks afterwards as a follow-up. Ashley and Cody, thank you guys both so much for your time. And Ashley, speaking for TouchCare, I know we really appreciate the partnership with Maestro and really enjoy working with you and your team, and have had sort of a slew of different experiences with clients and different TPAs in the reference-based space, and can sort of adamantly and confidently say we think you guys do a great job and we appreciate the work. So thanks everyone for joining, and that about wraps us up. Thanks.
Thanks everyone.
Have a great day.